Hi, I'm Dr. Nick and I'm the Incrementalist. Today we're talking about healthcare screening and why you should be getting your healthcare screening, taking incremental steps. And specifically we're going to talk about colorectal cancer screening. What's changed with the guidelines? Well, the guidelines have lowered the age which we believe you should be getting colorectal cancer screening, and specifically colonoscopy. That's for the average user. If you're a little bit more complex, or even if you've got any uncertainty, go talk to your physician about this and discuss it. These are all individual decisions that you've got to make in the context of your own personal health. But here's why the change. What we've discovered is that there's more cancer occurring in younger patients. So the important thing from a screening standpoint is to make sure that you get screened early. Why is that important? Well, in medicine, we know that if we catch things early, we're going to be more successful in the treatment of those conditions. So the earlier we catch something, the more likelihood of successful treatments, and that's what you really want. So incremental step, make sure that you get your screenings. For those of you 45 and older, you should be getting colorectal cancer screening, and specifically a colonoscopy. For everybody, we should be getting that fecal occult blood test. That's the test of the stool where we look for blood in the stool. The new tests are actually more specific, which is great news, because now you don't have to worry about the false positives and making sure that your diet didn't contain things that might have set the triggers off for that particular test. We've also got a new DNA test that is showing some promise, that looks for DNA changes in the stool that may be able to give us some additional diagnostic capabilities as well. But if you're 45 and older, you should be going for your colonoscopy, and if you're over 50, you should have already had one. And I know everybody hates the idea of a colonoscopy and the idea of finding something, but it's really not that bad. The celebrities have shown us that this isn't the end of the world. It's an easy thing to actually endure. The worst part of it is the bowel prep. I've been through it. It's not terrible. You drink some liquid that's, well, you know, unpleasant. What happens next? Well, the world falls out of your bottom. But you stay near the toilet, and that will allow you to just get through this. You typically go through it twice because the bowel prep is the most important thing. And then once you've finished, go to the gastroenterology center. They put you to sleep. You don't remember any of this. And ultimately come out immediately the same day, and they'll give you the results there and then. If they find anything, they send it to pathology, so there may be some delay, but ultimately the most important thing is finding this early on. Let me ask a favor. If you like this video, if you could subscribe to the channel below, and if you didn't, leave some comments. Let me know what I can do better next time. I'm Dr. Nick, and I'm the Incrementalist. Don't let perfection stand in the way of progress.